Thank you, Dr. Boise. And I'd like to say that it's a real honor for me to be here to speak with you today. I'm going to start by acknowledging that the presentation is sponsored by the American College of Healthcare Architects. We thank them for being such great champions for great healthcare architecture. I'm going to give you a brief introduction to our design practice, then focus on some examples of our more recent work in the healthcare sector. But before I do that, I'd like to briefly honor Michael Graves, who passed away in March. Michael was to be here to give you this presentation himself. We are sad that he's no longer with us. I have been with Michael for the past 35 years. He was my teacher, my mentor, my boss, my partner in design, business, and occasionally on the golf course. And he was my friend. Michael was the most passionate, optimistic, talented, insatiable, and determined person I have ever known. And if ever there was a time to see Michael as a great role model, it was post-paralysis. While we will miss him greatly, we will continue on with our work, and we will likewise carry on with his advocacy for the disabled and his mission to improve that patient experience through a humanist approach to design. That is exactly what Michael always said he wanted us to do. Now I'd like to give you a very brief overview of who we are and what we do. We're a multidisciplinary design firm based in Princeton, New Jersey. We do master planning, architecture, interior design, product design, and graphic design. We, in fact, really do design everything from towers to tea kettles. Our practice in the last 3 decades has become a global practice. And we don't really specialize in any one sector. We just bring good design to whatever the project is. So we've done a lot of civic work, hospitality. We do residential work, both as private homes and multifamily residential. Education, we've done a lot of work on university campuses. Special office buildings, interior design, and master planning. And in the mid-1980s, Michael got a chance to start to design products. It started with a commission to do some art rugs, but that boomed into a business where we were designing tableware and jewelry and other homeware items throughout the 80s and 90s. That then grew into opportunities to design furniture, bathroom fixtures, light fixtures. And in the late 1990s, 3 Minnesota companies got together to help fund the restoration of the Washington Monument. The stonework was in very bad shape, and they knew it was going to be shrouded by scaffolding for a few years, so they commissioned us to design the scaffolding so it would look better. And you see the scaffolding in these images. And the scaffolding actually kind of told the story of what was happening with the Washington Monument. It was about fixing the stonework. While we were doing that, we met Target, the big discount retailer, and they invited us to design some custom products for their stores. And it was a big hit. That turned into a 12-year relationship where we designed over 1,500 products for them. Over the last 25 years, we've designed over 2,500 products. And that's a fact that most people wouldn't know. But the one sector that we never got to work in was healthcare. That was always reserved for experts. In 2003, Michael was paralyzed by an illness, and that brought us to a whole new place. And I'm going to let you hear from Michael himself with the CBS Sunday Morning News clip, and he'll tell you about our most unintended change of plans.
It's Sunday morning on CBS, and here again is Charles Osgood.
Designing everyday products like these, designing entire buildings to put them in, that was what architect Michael Graves did until fate forced a change of plans. How Graves responded to terrible adversity is the subject of Martha Teisner's Sunday Profile.
To me, design is about simplicity.
In the new Target ad,
It's about inspiration.
you see the wheelchair and wonder.
Everyone can afford great design.
No, he wasn't always in it. Yes, the story is remarkable. Michael Graves had it made. Among architects, his was a name to be dropped. He'd built trophy buildings all over the world. The household products he'd designed for Target stores were so popular, people called the color they came in Michael Graves blue.
Michael Graves has created art that surrounds our lives.
Here he's being awarded the National Medal of the Arts. On February 23, 2003, at age 69, success was a given in his life. The very next day, his survival wasn't even a sure thing.
I got off into a bad start.
In unspeakable pain, over the course of 24 hours, Michael Graves became paralyzed from just above the waist down.
There you go. Good.
We met him that July, 5 months after he developed the horrific freak virus that quite literally ate sections of his spinal cord.
Just like you were hitting a ball, exactly. Swing it right across.
He was a patient at the Kessler Institute, a rehabilitation facility in West Orange, New Jersey, in combat with the new given in his life. But as you will see, this is not a story about anger and denial and self-pity. This is another Michael Graves success story.
You certainly get frustrated, my goodness, trying things that you can't do until you can.
In his new altered world, Michael Graves, the patient, revised his expectations. Michael Graves, the designer, did not.
I refuse to use Velcro. A little too ugly for me.
That was like day one request.
Velcro's too ugly. What about the decor in here with the various flowers and the pumpkin sheet?
I wasn't the architect.
There were stories that when he was first in the hospital, at his sickest, he said, "I can't die here, it's too ugly."
Is that true?
I did say that. I said that, and yet little did I know there were uglier ones.
Graves would spend the next year in and out of hospitals, but there was this consolation: he could still draw.
When I was growing up, the one thing I could do well was to draw.
As a child in Indiana, as a student in Italy, as a practicing architect and designer, drawing was his passion, his vocabulary of choice, an expression of his sense of humor, an extension of his thoughts. Now it was a symbol of his ability to go on working. He never stopped, no matter how sick he was, no matter how much pain he was in. He never gave up. Now what matters to him most is time, having enough time to make a contribution.
Instead of sort of giving up, you say, how can I extend this life so that what I know now I can extend and make more of than I would have if I hadn't had this.
And if there is also time to draw and paint, so much the better.
Now, how many architects have this much fun, I ask you?
So in that first year after paralysis, Michael was in 8 hospitals and 4 rehabilitation centers, and it was 11 and a half months before he finally came home. And then over the subsequent 3 years, he was in and out of hospitals for various surgeries and treatments. The office is very much like a family, and so the senior people were all part of this process. I spent a lot of time in healthcare facilities with Michael, and we were determined that we could do it better if we brought our attention to it. We've always approached design from a humanist point of view, meaning that rather than trying to create iconic structures that are all about the wow factor, we really care about how they work for people. We know we're designing for people. We've always tried to bring innovation to our design work. We realized that if we could add empathy, which we definitely had after going through the experiences that Michael had to endure, that we could really make a difference in the healthcare sector. Michael, in fact, declared himself the reluctant healthcare expert. Soon after he came back, he started to speak at healthcare conferences as a thought leader. And then the first client in the healthcare sector came to us, and that was Stryker. And they asked us if we would design a line of patient room furniture that looked better. But the truth is, we wanted to actually make it work better. We started with a research process. We studied, we benchmarked what's on the market today. We interviewed all the stakeholders, so the clinicians, the patients, the transport services, the families, and most importantly, the environmental services. We identified some of the key problems. We conducted ethnographic research, which is a fancy way of saying we just observed. And one of the things you learn when you do that is that people don't always tell you what really happens. They tell you what they think they're supposed to tell you, but if you observe, something else happens. We saw some of the key problems in patient room furniture is infection control. One of the problems was that the bedside, or the overbed table, is so clunky and hard to operate that people are grabbing it underneath the table, but the environmental services are not cleaning underneath the table. We found that falls, especially for people who are weak or feeble, getting in and out of chairs are a problem, and we saw that clinicians' injuries and back strain are a problem. So this is that first line of furniture that we did for Stryker. And we'll start with the overbed table. Now, if I point to things, I'm going to point to the right-hand screen. So you'll see that the tabletop is very thin. When we were studying some of the products that are on the market, we found that the top was so fat that when you lowered the bottom to your body, the top was actually kind of high. So that was a key thing for us, that the top had to be thin. Something else we found was it was very hard and counterintuitive to operate the table, to get it to go up and down. You had to grab it and pull up to then push down to lower it. And you had to use both hands, and you had to grab under the table. So this is designed with very simple operation here. Literally with 2 fingers, you can push it up to have it go up, and push it down to go down. We added a contoured edge, sort of like a mini bar edge, so that it was more comfortable to lean your arms against. And believe it or not, that contoured edge gives us 32 ounces of spill containment on the top. We wanted to create a zone where the patients had their personal stuff to the left, so that the tabletop might be clear when the food services people came to deliver the tray. As most of you here probably know, they can't move anything of the patients if it's in the way, and they therefore can't deliver the food tray. We wanted to make it clear where you handled it, so we put a handle on it there. And the environmental services people know to clean the handle. It actually glides around. It's not hard and clunky to move. And this is its partner, the bedside table. We designed it so that the drawer could go both ways, so that it's neither right nor left. It can be located at either place. There's a flip-up charting surface. There's a little trash receptacle that can be closer to the patient who's up in bed, not sort of down so low like a trash can on the floor. There's a plastic bin for personal items, and the patient can just take that home with them. This is what we call the stand assist chair. We saw so many people who were weak, we called it the drop and hope, where they would get to the edge of the chair, they couldn't quite reach the handles, and they would drop into the chair. And it all looked so risky. So we designed this handle to come way out in the chair so that people have something to hold on to from a near standing position. And you can see how that works. We call this in therapy, they talk about getting your nose over your toes as the proper position. You can see as he's standing or sitting down, he still has support on the handles, so they're finally in a standing or sitting position. And that collection was very successful, and Stryker was quite surprised to see the thinking behind the products, not just the aesthetic. So they asked us to take on another mission, and that was to design a better transport chair for use within a medical facility. The folding wheelchair was designed in 1933. In 1933, this is what a telephone, a camera, and a computing device looked like. Today, this is a telephone, a camera, and a calculating device. And today, this is the folding wheelchair. Look how far it's come. So we did what we did with the furniture. We started by researching. We went to 38 hospitals in the United States and Europe to see what are the issues. We did our ethnographic research by watching the escorts. One of the things we were amazed to see was if an escort took a patient from their room downstairs for a test and back up, how many times they were bending over individually to operate this stupid chair. Each break had to go individually, come around the other side, do that break. You've got to get the footrests out of the way. It's also not very ergonomic. Just try it. The positions your hands have to be in to push the standard wheelchair is very awkward. We studied what patients did, and as all of you know, the patients are not very patient. They want to get in and out of the chair, but that's often before the foot pedals are out of the way, and that's a risk of falling and injury. And then the thing that really surprised us the most is we learned that nationally, 30% of the wheelchair fleets are stolen every year. You know, grandma needs a chair for another month. We're not going to buy one. And of course, if they're going to steal it, they steal the new ones. So after all that research, we sat down and we thought about how can we make a better chair that serves the needs of all the various stakeholders, from the manufacturer to the hospital, to the patient, the transporter, and the maintenance staff. And this is the chair we designed. It's called the Prime TC chair, and I'm going to show you a little video. You can see how it operates.
The Prime TC is designed for the patient, caregiver, and hospital. For patients, the design is about comfort, fall prevention, and reduced exposure to infectious disease. Smaller back wheels are out of reach, so patients do not come in contact with any contaminants wheels can pick up throughout the hospital. The open design of the frame and spring-loaded footrests guarantee an unobstructed path to the seat. Stand-assist armrests aid in the ingress and egress by providing a touch point at the right height and position. The seat and seat back are contoured for maximum comfort for patients weighing up to 500 pounds. For caregivers, the Prime TC is about eliminating bending and reducing strain. Push handles are placed for optimal maneuverability. Brakes are foot-operated. Storage for key clinical equipment is integrated. Swing-away footrests and pivoting armrests provide unmatched access to the patient. 30% of wheelchairs are stolen every year from hospitals. Prime TC's non-folding frame discourages theft. The chairs nest for storage. The Prime TC is manufactured in the US and backed by a 5-year warranty.
One of the many problems we found with the standard wheelchair is when a patient's sitting in it for a long period of time, say waiting for a test, they start to play with it. They play with the wheels. But the wheels have been on every floor surface in the hospital. That's not very smart for infection control. So as you saw in the video, the wheels here are much smaller. You can't reach them. The standard wheelchairs has lots of seams and crevices, both on the handles and in the seat. We have smooth surfaces, so it's easy to clean and there's no place for contaminants to hide. You saw how the foot pedals flip up out of the way so the patient can't trip. You saw that the clinician doesn't have to bend over for anything on this chair. And you saw that the handles are in a much more ergonomic position. And then finally, we have this bright colored top to the IV pole so that the transport services can see at the end of a long hallway that they have a chair left there. The chair's been on the market for about 1.5 years now, so there have been a couple of studies done on how does it really perform. This was a comparison between a standard wheelchair on the right images, and on the left, it's the Stryker Prime TC. They took the chair through 25 cycles of contamination with a riboflavin solution and then cleaned it 25 times. And then under a certain light, it would show up, if the bacteria was still there, it would show up as green. And so you see in the standard chair, on the armrest, in the seat, and on the handles, yes, indeed, there's still contamination there after cleaning. But on the Prime TC chair on the left, you see that there's no contamination. The first hospital to convert to the Prime TC chair was the Penrose Hospital in Colorado. And they said the main reason they were converting was because of theft, that they had a real problem with theft, they had a real problem with replacing parts. Oops, didn't mean that. So they've had this chair for 1 year. Stryker went back to them and said, so how did we do? And they said they haven't had a single chair stolen, they haven't had to replace a single part. So we think this is a much smarter wheelchair. Recently, we've just started a product program with Kimberly-Clark, we're going to design a series of personal mobility and home care products. This is the very first one. It's a walking stick, and we're about to start test marketing it. We wanted it to be fashionable, so it comes in colors and it has different styles for the handles. But what's really important is the tip. If you look at that tri-tip, show you how it works. So that tri-tip allows the cane to stand. It doesn't always have to fall over. The handle allows you to carry it on your arm. It can rest along a table. Most importantly, that tri-tip gives you a lot of grip. It wouldn't slide out at an odd angle. It just maximizes the surface contact. And if it falls over and you step on the tip, it pops back up. It has some replaceable parts so you can customize it. And it will lean without slipping and falling down. As architects, more recently, we've gotten to do some healthcare work. But in the beginning, after Michael's paralysis, we got invited to do projects for people with special needs. For instance, we did a school for autistic children in Washington, D.C. In a military base in Virginia, we did a series of houses for the wounded warriors. And we made sure they worked for people who had a variety of disabilities, missing limbs, wheelchairs. But we wanted to make sure they didn't look like disabled homes. So, you know, one of the dead giveaways is a house that's got a 30 feet of switchback ramp going up to its front door. We wanted to make sure you could just roll right straight into these houses. And this is another one. And as I mentioned, the interiors, including kitchens and bathrooms, were designed so that somebody could live there in a wheelchair. More recently, we've done a couple of projects at the Yale New Haven Hospital. The first was to design an acute care unit for elders that would address the special needs of that population. As I've shown you before, we started with the research. We interviewed all the stakeholders. We did the ethnographic research. One of the things that the nurses were telling us was that many of these patients have poor eyesight, and that environments like these bathrooms you see, where the colors are all monochromatic, they're all whites and off-whites, that they can't distinguish between the surfaces, and it promotes or adds to the falls. Oops, didn't go back. You'll see also in the center 2 slides how sloppy the precautionary signage is, and it often falls down on the floor. So we took this existing clinic, nursing unit, and renovated it. You'll see one of the key things we did was to have the nursing station open all around so that the nurses could really keep an eye on almost all the rooms without ever really having to move. I know that there's a debate between what is the appropriate floor surface in a nursing unit, but here they wanted quiet, so we used carpet squares. And in the patient rooms, we made sure there was contrast in colors. You can see, especially in the bathroom, that there's contrasting colors and you can distinguish between the surfaces. We also added these kind of stand assist handrails at all the places that you're doing something. So if you're getting soap or a towel or operating the shower controls, there's a rail there to help you steady yourself. They also said that some patients had trouble identifying which door was theirs. So we designed these very brightly colored portals, and we made the signage for the room numbers big. And you can see that the precautionary signage is much more organized. They were very happy with how that turned out, so they asked us to design or redesign their emergency department. Their current emergency department is a little bit inefficient in that patients are taken just in the order they come. They're taken to a treatment bay, and they may or may not be critical. So we redesigned it to add 2 triage rooms here at the waiting area. So patients can be seen first, and they can determine who's an urgent issue and who can wait a little bit. We also managed to redesign it to get some more treatment bays in the same space, and we created kind of a one-way flow from in to out. And there's a rendering of the reception desk and the triage rooms and the waiting area. And then finally, we're working on a hospital right now. It's a rehabilitation hospital that's being built in Omaha, Nebraska. The client is an existing rehabilitation hospital in Lincoln, Nebraska, and they're expanding to Omaha. We're building a 110-bed facility, and they handle the more serious cases. This was a place, the kind of place that Michael Graves was. So they have spine, neck, brain, burn patients. Over the last decade, they've always had a number of patients coming back from Iraq or Afghanistan. One of the key things in their design brief was that they wanted to make sure that we designed an institution that didn't feel like an institution. They wanted it to feel like a village. They wanted patients to realize you've left the acute care environment behind and you're on your way home. You're moving on to something different. And so that's a view of the front entrance to the building. We spent an enormous amount of time studying patient rooms. This is a floor plan of the patient rooms, a pair of them, to see what would the best patient room be for them. Their patients stay there a long time sometimes, so they need storage, and families are often with them. So you'll see on one whole wall, we have a wall of storage, so patients have places to put stuff. There's efficiency for the clinicians. Their zone is right when they come in the door. We tried to get the bathroom door right next to the bed. We know that many of these patients have electric wheelchairs which require a larger turning radius than ADA tells you. So we have larger turning radiuses everywhere. And in fact, people who use these electric wheelchairs, those chairs kind of become their home, and they fill it with their own stuff. So we created a place that's big enough to park an electric wheelchair in the room. We created what we called a family alcove, which has a sofa that converts to a bed and has a little TV. So a family member who's spending a lot of time at the hospital can kind of get away in their own zone, maybe check in with work, get online, maybe watch their own television show. These are two renderings in the patient room. We wanted to make it warm and friendly, but we weren't going to fall into the trap of trying to pretend it's a hotel room. A hospital is not a hotel. And you can see across from the bed that there's a lot of storage and place for people to put things, including things like flowers and teddy bears. And there are rails where they can hang pictures and get well cards. This is a typical nursing unit. We also spent a great deal of time studying the nursing unit. What you have is 8 rooms on each side, and the nursing station's in the middle. And one of the keys was that the nurses never be very far away from the room, so you can see how close they are to each of their rooms. All of the support stuff, the back of house is here, connected to a service elevator with a back of house corridor. So the back of house things don't happen out in the patient corridor, and the public circulation is out here beyond the nursing unit. This is a floor plan of one typical floor, and you can see that there are 3 nursing units, 1, 2, 3, that add together to make up a floor. That in the center there is a day room. And this is a rendering of that side of the building. So these are the fingers of the nursing units, and that's the day room. The very heart of this facility is rehabilitation. And in this hospital, we wanted to celebrate rehabilitation. We wanted to make it an important part at the center of everybody's lives. That's what people have come here to do. It shouldn't be seen as a kind of an out-of-the-way place. In their current hospital in Lincoln, they have a number of rooms they call Independence Square. And it's there to teach you how to go back to your daily lives. So you have different bathroom configurations, kitchen configurations, laundry. And we're going to have that again in this hospital. That's a rendering on the left of the central gym space. And we wanted to make sure it was a very uplifting space, maybe even a little spiritual. We wanted a lot of daylight. And we wanted to keep the colors very warm and friendly. We didn't want it to feel like a cold place. The 2 renderings on the right are typical day rooms. So we've really sought to make a difference in healthcare. I've shown you a few examples. In 2010, Michael was named one of the most influential people in healthcare design by Healthcare Design magazine. And just within the last 2 months before Michael passed away, he was given a lifetime National Design Award from the Cooper Hewitt Museum in New York. And Fast Company named us one of the world's most innovative companies in design. And they highlighted that Michael sought to make a difference in healthcare. Thank you, everybody.